All right, so welcome everybody. My name is Brian Feeley. I am the Senior Vice President of Marketing for Corporate Synergies, and really glad to be helping to facilitate these live briefings with Dan Kuperstein and Dorothy Summers from our compliance team. The idea behind this is to kind of give you quick updates on what's been happening, and we will continue to do these in addition to the webinar series that you should be aware of as well, where we get a little bit more in-depth, and that is credited. But this is just to give you a live briefing as to what's going on. So welcome. You can see probably up in the window there, use chat to submit your questions. And Dorothy, Dot, as we call her, so Dot will go ahead and she will answer questions as they are asked as much as she possibly can. And if we need to throw the question out there for all to hear and for Dan to answer, we will do that. But yeah, definitely use the chat feature. So with that, Dan, if you don't mind just introducing yourself, everybody probably knows you, but go ahead and introduce yourself and we'll get started.
Sure. I'm Dan Kuperstein, SVP of Compliance for Corporate Synergies, and where we help clients all across the country to understand the legal and regulatory challenges that affect their health and welfare and insurance plans. And that's
what we're doing today.
We do. That's what we're doing today. That's right.
Well, I'm excited to hear what's going on because, you know, watching the news, since the last time we had one of these, a lot has happened. I mean, we have a whole new administration, and right near the end of the year in December, there was a huge stimulus package that was passed. And I know we were looking at that, but what, if you just to start things off, what was the impact of that? Maybe if you can go through some of those areas for us.
Yeah, definitely. This major relief package that was signed at the end of December called the Consolidated Appropriations Act of 2021, we'll call it the CAA for short. It was just absolutely huge, right? It was a game changer, especially for health and welfare plans and insurance. I mean, there's so much that we could talk about. I mean, we could really do a 2-hour plus webinar just on this topic if we wanted to. And we do have an e-alert on this topic that is available on the Compliance Resource Center page of Corporate Synergies. And we'll put a link to that in the chat that kind of helps you understand that in more detail. But just to give you a quick overview, right, of some of the key things to take away from the CAA and its impact, you know, are one, right, this new optional FSA flexibility. And so what happened was for both healthcare FSAs and dependent care FSAs, and we're going to dive into more detail on these a little bit more later. You know, the key thing to understand is that these new rules, if your plan should voluntarily adopt them, they allow you to, and again, this is very general, they allow you to carry over any unused balance from a dependent care or healthcare FSA into the next plan year. They allow you to extend the FSA's normal 2.5-month grace period of 12 months. They allow terminated employees to spend down their plans for the duration of their plan year, even if the terminated employee is at another employer. And they allow you to change the dependent care FSA rules to add an extra year to eligible dependents. So you can, you know, now an eligible dependent can go up to could go from the maximum, which was before, up to age 13, now up to age 14. And Dot and I have a little more we wanted to talk about on this stuff, but let's talk about some of these other big changes that happened. Of course, there were big surprise billing rules in this law called the No Surprises Act. And, you know, there's a lot of information out there, but you really want to make sure your plans are complying with all the new disclosure rules and procedures to prevent surprise medical bills, which generally speaking, those are, you know, bills from out-of-network medical providers that typically received when a patient is forced to use a provider during an emergency. And those rules go, those rules go into effect for plan years beginning on or after January 1st of 2022. And then of course, there's also new mental health parity rules that really only impact self-insured plans. And even then, in most cases, probably the third-party administrators will be handling those, but those rules require that self-insured plans create what's called a comparative analysis of the plan's non-qualitative treatment limitations under the mental health parity rules. And the quick basic English way to explain this is that your plan had to do this before, right? The mental health parity rules have always been in effect, or not always been in effect, but long before this. But now there needs to be some kind of comparative analysis of that shows how your plan is complying with the mental health parity rules. And I think in probably all cases, your TPA or applicable insurance carriers will have probably already created this, but that has to be ready before February 10th of 2021, which is today. So that goes into effect today, and they're going to be they're going to be auditing for that at some point, although new regulations haven't come out yet as to how that's exactly going to work. And then, of course, we have new paid leave. There was some paid leave changes and other extensions of tax credits applicable to insurance. So one thing that didn't happen was that the CAA did not extend the FFCRA mandatory paid sick leave and paid family leave past December 31st of 2020, but it did extend the paid sick leave tax credits all the way until March 31st of 2021. And so, that's an interesting thing, right? So what that does is it extends employers' ability to utilize those tax credits until March 31st of 2021 if employers choose to continue to allow employees to take that type of leave. But one thing to note, of course, is that this doesn't extend the maximum amount of leave that employees have under the FFCRA. It's just, for employees that want to use it after the December 31st time period. So definitely an interesting development. And then going back to the FSAs, I think that we wanted to talk about, there's a lot of information there that you can read about, but it's very important to understand. And I think one of the most important takeaways that we wanted to let our clients know about is that the relevant IRS guidance that typically comes out after something like this has not yet been released. And so there's some very different interpretations of the statute, the CAA, that came out. And the statutory language was very vague and ambiguous, and there were unclear ways to, different ways to interpret it, leading to different ways that's being administered by the FSA administrator. So if you want to, if your plan wants to take advantage of this, definitely, take the time to speak with your FSA administrator to make sure you understand how they're interpreting the statutory language and how they're administering it. And so, Dot, do you want to give us some examples of some of the things we've seen out there and some of the differences from the administrators?
Sure, and because those rules are so vague, I mean, the actual piece in the regulation was only 5 pages long, right, out of 5,000 on the whole law. So, I mean, they just, again, vague is not really the right answer. It was, extremely vague. So there, it just basically said, if you allow these extensions, it doesn't make your plan not a Section 125 FSA or DCAP plan. So some of the things that we're seeing is, from some of the carriers interpreting this on, is it really the whole amount that's left over? So if you're going to carry over what's left over from the previous plan year, is it truly that whole amount plus, a new election? We saw that. One of the other related to the terminated employee piece is it truly an employee who's terminated from the company and truly terminated from the plan, or someone who just is still employed but decided to terminate from the plan? So that was another question, that we did see that is, seems to be confusing. And some of the things we've been seeing from different vendors where even though these plans allow very much flexibility for an employer to pick and choose what they want, if they want, they don't necessarily, and again, we're waiting for final regulations, but, could an employer say, we're only going to let an employee roll over $1,000 versus everything left in their carryover? Well, we have some vendors saying it's an all or nothing. We actually had another vendor who said, you're all going to do this, and if you don't want to do it, you got to opt out of the plan. So, lots and lots of questions right now, and again, go ahead.
Yeah, I was just going to say, because it seemed like in the beginning when we were talking about it, it's up to you. At least that's how some of it's optional, it's voluntary, but yet at the same time, how do you know whether or not you want to move forward with things when there's no real final guideline on the impact of making those decisions or going down those paths?
And another situation too is, and this is a lot of questions that we got, and I would ask employers, do you want to implement this? And they're like, well, our plan is just ending now. We really don't know, you know, how much money people have left yet, right? Because there's regular run out periods where people can still submit claims. So some employers are being very proactive and saying, yeah, we want to do this. We know our employees have a lot of money left. Others are saying, well, you know what, we need to evaluate. We need to get a little bit more into 2021, see how the claims are coming out, see, you know, if we do have a lot of employees with money left over. And that's really the goal here, I think, with a lot of employers is they want to do right by their employees. They want them to be able to use those you know, unused funds, but it's still a decision that's happening.
Is there any ETA? I mean, I know you can be waiting. There's been these situations in the past where guidance is coming, and it doesn't come. But any thought as to when, given the timing of this and people wanting to make the right decision, any thoughts on when you might get those guidelines?
Yeah, unfortunately, I have not seen anything. I mean, I don't know if you have, but I have not seen any exact ETA date yet, or on when regulations or guidance will be issued on this. But I think, you know, one of the key takeaways, of course, is that, well, actually, one way I would say is that this is similar to what we've seen in the past was with tax reform, right? So a tax reform went into law in 2017. You know, employers and plan sponsors started administering their plans in certain ways, especially when it came to UBIT and qualified transportation plan benefits. And then they found out later when regulations and guidance came out that it was very different from the way that they were administering it under how they had read the statute. So I think it's very similar to that situation that we saw with tax reform and the special UBIT laws for nonprofits and their transportation plans. So, you know, we would just say it's probably best to be conservative, exercise caution, don't go too crazy, and also maybe limit some of those rules. There's ways to limit you know, how your plan interprets those rules, and that may be a good idea, so that it's not a little bit too wild and crazy when those regulations or guidance come out.
Okay. I'm going to pivot a second because you know what? It's 2:13 p.m., which means there's probably 5 more executive orders signed today by the Biden administration. President Biden putting these executive orders in. Can you speak to some of those? Because a lot of them have impact on healthcare. So maybe just, you know, these executive orders with President Biden, talk a little bit about that impact.
Yeah, that's a great point. I think as one of our clients said, I think they put it best when they said, you know, it seems like Biden is getting the old band back together. And I think that's really the best way to look at this, because, you know, he's getting a lot of the people back from the Obama team, and he has said in many public statements that he's trying to roll back the Trump version of the Obamacare laws and bring it back to the way it was and restore it back to the way it was, to quote his words, during the Obama years. And so he did really several executive orders on healthcare. It really in that first week and a half that he was president, in that first executive order that I think that was probably the most relevant to, you know, directly impacting everything in the healthcare world was one that expanded access to exchange plans and exchange coverage and Medicaid plans, and did a number of things, including creating a new special enrollment period on the exchanges, the government ACA exchanges, from February 15th through May 15th of this year. So basically it's like another enrollment period where people can enroll in the exchange plans. That was done to help people through the COVID pandemic. And as part of that executive order, it also repealed the policies of the Trump administration on healthcare, including President Trump's very first executive order, which stated that it was the policy of their administration to repeal the ACA, and as well as another executive order that directed the agencies to issue new types of coverage like short-term limited duration insurance and new rules for association health plans and things like that. So basically they're essentially rolling all that back, right, and bringing it back to the way it was under Obama. There was another memorandum issued by Biden designed to rescind the Trump administration policies on reproductive health care to make it easier for more individuals to get access to such care. And then there was an executive order that was ensuring that the agencies issue rules that protect the rights of LGBTQ participants under Title VII, and that was really designed to ensure that employers comply with Title VII, as well as the recent Supreme Court decision from June of last year which ensure that employers can't discriminate with regard to employee benefits on the basis of sexual orientation or gender identity. And we did an alert on that from back in June of last year. And then, of course, also the Biden administration issued a memorandum in January that freezes a lot of proposed regulations of the Trump administration. And probably most relevant to what we do, it froze the proposed rules about wellness incentives that were issued really the very last, kind of the last week of the Trump administration. They issued, the Trump administration's EOC issued 2 sets of regulations about how wellness incentives should work for wellness plans under ADA and GINA. So we still have, I guess, to wait a little bit longer to understand, what kinds of wellness incentives can be offered under those wellness plans that are subject to the ADA and GINA. Mm-hmm. And I think if we look at the big picture takeaway here with all these executive actions is that, he's really, President Biden really wants to restore the protections of the ACA as it was originally written, and really kind of expand it to more individuals that it was supposed to protect. And so that's kind of the big picture takeaway. And I think along with that comes more enforcement of the ACA and a lot more regulatory action and guidance action. And even just in the last few days, we've seen a lot of new guidance come out of the CDC, including on how to wear masks better, how to have, recommending double masking and better fitting masks. We saw recently CDC guidance that came out on how employers can implement a vaccination program if they want to, helping them figure out the considerations that are involved if they want to do a mandatory vaccination program for their workplace. So a lot of things really, that's definitely one of the big priorities of this administration is to really, let's tackle the COVID thing first, and then let's, also to the best way we possibly can restore the ACA back to the way it was before the Trump administration.
Hey, Dan, on vaccines, because everyone's talking about vaccines right now. CDC guidelines. So, CDC will talk about how to wear a mask or what the best path forward for you to make sure that you're protecting yourself. Same with vaccines, guidelines on how you might manage that, but it's not enforced. They're not saying this is the law. This is just simply, if you were to consider this is how you should go about it, right? Nobody has come out and said, this is what an employer can and shall do as it relates to mandating that they be vaccinated or not. If you could speak to that or where things are for people trying to make those decisions.
Yeah, that's a great question. And I know it's something that a lot of our clients have asked about. And I think the key takeaways there are, I think before we get to, I think the big takeaway there is that it's still okay. There's no law that expressly prohibits an employer requiring that employees take the COVID-19 vaccine prior to coming back into the workplace. So it's still permissible under the current law. But what the guidance has said, and really more so in the EEOC guidance, although the CDC guidance refers to the EEOC guidance, it says there still has to be protections for employees who have disabilities and religious protections for those employees who have sincerely held religious beliefs that would prevent them from taking the vaccine. So there still have to be those exceptions and accommodations in place for any kind of mandatory vaccination program. And then another thing I think that's important to take into account is even while the guidance has come out to say that, there's also a lot of things you need to be thinking about from the employee benefits compliance standpoint of, is this going to be considered a group health plan or vaccinate later on? I think not now. Right now, really, it's a federal program. The federal government is administering these vaccines, and they're free, and you get them in a government approved center. But later on, of course, once it becomes more like a flu vaccine, which it will actually become, right? There's going to be a lot of those same questions that employers have to deal with when they implement flu vaccination programs, which is, will this be a group health plan under the law, and will we have to add this information to our plan document and COBRA and everything else? And the answer is yes. So under the current rules for employee benefits, it is something that if you are going to be mandating and putting into your health plans, you do want to comply with all of the group health plan requirements under ERISA, COBRA, and the rest. And so it's just definitely something you should be talking about with your advisors like us, if it's something that you know your client is that you're looking at implementing.
Okay, I'm going to pivot one more time here. All right, so we had Obamacare, we had Trump care, and with everything related to the new relief bill that they keep negotiating back and forth, a lot of it has to do with the ACA. Are we heading towards a lot of change there? Are we heading towards a metamorphosis of this into Biden care? I mean, what is the next iteration of this that you can look into your crystal ball and tell us about?
Yeah, I mean, you know, we've really we've been following this closely. Dot and I wrote an article that we put on the company's page, kind of about some of the different things that were proposed by the Biden administration as part of their campaign and ways that it would change the ACA. And we can put a link up for that. But in the near term, right, just yesterday, we saw a new proposal from the House Democrats that and there was a summary released yesterday by the House Ways and Means Committee that was very interesting. It would extend COBRA subsidies, greatly expand ACA subsidies, expand and extend benefits and leave-related tax credits. So just really a comprehensive, very, very comprehensive proposal for the next COVID relief legislation. And specifically, just to get a little more specific, among other things, it would fully subsidize ACA coverage for people earning up to 150% of the federal poverty level, as well as those on unemployment insurance for 2 years for 2021 and 2022. It would end the subsidy cliff, which would, qualifying enrollees for premium tax credits who make over 400% of the federal poverty level, and allow them to get those subsidies for the first time. That would also go for 2 years, 2021 and 2022, and it would cover 85% of the cost of private health insurance for those laid off during the pandemic through September of 2021. So pretty comprehensive provisions, but I think it's important to remember, right, this is just the House Democrats' proposal, right? We have yet to see how the Senate Democrats are going to look at some of those things, how they might tweak them a little bit. And so this is still very much in the works, but because it's going to be done through the budget reconciliation process, they don't need Republican votes, which is an important thing as well. So they, while we'll still see some tweaks, they're going to get a lot of the things that they want here.
So similar to some of the other e-alerts and guidance that have been sent out, we're going to be looking at this, and when it does come to fruition, there'll be more guidance from you, I'm sure, and the team.
Definitely. I think they're looking for the end of the month too. I think they're looking to have this done by the end of February. It's kind of the timeline.
Perfect. Well, we're coming up on what we're turning into the end of our live briefings, where we have 3 quick takeaways. So Dan, take us there. 3 takeaways that you'd like every employer to know about at this point.
Sure. Yes. So it's kind of hard to do 3 quick takeaways when there's so much stuff that's happened, but
those are the rules, Dan.
Yeah, I'm sorry. Yeah. Okay, I'll stick to the rules. I got to be in compliance, right? So let's talk to, I think the first one is you really want to kind of talk to your FSA administrator about the things that Dot talked about, right? Those things that Dot talked about are so important, right? Make sure that if you really want to do those optional FSA rules, you want to amend your plan, right? Make sure that you're doing it right. Talk to your benefits advisor at Corporate Synergies, and we have great dashboards and information about that lets you get a really good window into what's happening with your plan. We have all kinds of tools to help you with that here at Corporate Synergies. The second thing is really make sure your plan is affordable and complying with those minimum standards of the ACA, like MEC, minimum value, affordability. It's something we really pride ourselves in making sure all of our clients are doing that every year. But now that enforcement, it looks like it's going to be ramping up under the Biden administration, and they're really going to be watching that more closely. You really want to make sure you're on top of those things, and that's a big thing. And then I think with the third thing I would say is just with so much happening right now, and it's out there, definitely keep checking our Corporate Synergies Compliance Resource Center page, where we post a lot about things that are, not just our e-alerts on major legislative developments, but also a lot of proposed rules and guidance that comes out that, we're updating those regularly. Also check out our social media employee benefits compliance page, the Health and Welfare Compliance Forum, or HAWC, and it's spelled HAWC. And definitely make sure to sign up and tune in to our upcoming compliance report briefings and quarterly update webinars with Dan and Dot, where we're going to be talking about all these new rules and initiatives that are just coming out so quickly from the Biden administration.
Perfect. That's always good advice. With 5 minutes left of the time that we have for the live briefing, I just want to open it up if there are any questions. And Dot, if you see any unanswered questions that we need to handle right now, now would be the time to post them in the chat so we can answer those. I'll give you a few seconds to think about that and add that. But Dan, there's a lot throughout the year as people take a look at the events page, especially as it relates to the Compliance Resource Center and some of the things you have coming up. You're going to continue with your series, your compliance update series that goes throughout the year as a real webinar. And again, those are available for both SHRM and HRCI credits. We're going to continue this series because there's going to continue to be a lot to talk about. And I like the free-flowing way in which this is happening. I hope that we get a lot more questions in a setting like this. But, you know, it's early days, so we'll continue to push on this format and see where it goes. But I just want to say thank you to Dan, Dot, the entire compliance team for continuing to keep us all up to date, and for the employers and our clients and everybody out there. Hopefully this is helpful for them to make the right decisions to for their organization as all this information comes down the pike. You make sense of it for us. So thank you very much. With that, this ends our live briefing. Thank you, everybody, and we look forward to seeing you the next time around. Thank you.
Thank you.